Welcome to Checkup Check-ins by Healthy Connections TeleHealth. Our guest today is Dr. Sherilyn Webb, who's a primary care family medicine physician in Mena. How's it going down there, Dr. Webb?
It's a beautiful day here. How are you doing?
We're doing very good. So Dr. Webb, we are still offering in-clinic appointments right now. Can you talk a little bit about some of the precautions that our clinic is taking to make sure that our patients are safe when they come see us?
Okay, yes, we are still open and we still are seeing patients in clinic. In fact, we've been fairly busy this morning. We are being very cautious. All patients are screened for temperature and have a COVID questionnaire that they're completing before they are allowed to come into the clinic. If they have any symptoms or any factors on the screening that make it advisable for us to do further screening, they would then be diverted to the side where the patients are being tested. And otherwise, they come in, the staff is wearing masks. We're, of course, washing our hands hundreds of times a day, and we're being very careful to disinfect all of the rooms. The sick people are not in the same portion of the clinic with the well people, not at all. There are separate entrances, and there's never a mingling of the patients who might be ill with patients who are here for routine checkups such as diabetes, asthma, etc. And we have had a fairly good turnout of patients in person, but we're also doing telehealth meetings with patients who are either unable to come in or feel uneasy about coming out. We're being very careful to try to get the patients out of the waiting room as soon as possible. They're having minimal time in the waiting room. Some are even waiting in their cars until they are ready to come directly back to the exam room.
So my next question was going to be about telehealth. What are some of the things that you can do with patients over telehealth that will enable them maybe to not have to come into the clinic?
We can set that up with most patients. They do have to have a consent form, and they can fill that out basically online as well. The front office staff will walk them through that procedure, and then they set up an interview very much like what we're doing right here, where I can see them, they can see me, they can show me a rash on their arm, they can open their mouth and I can see down their throat. uh, in some instances, we are very fortunate in that we can have one of our home health nurses present for the interview to listen to their lungs, relay even more detailed information to us about what the condition is, and it facilitates diagnosis and communication to do that. But it's the patients actually so far have been very receptive to the telehealth meetings, and it's very reassuring to them to be able to talk directly to their physician, despite the fact that we have some limited access due to the fact that no one wants to be out and about and we're social distancing as instructed right now.
And if you're seeing a patient by telehealth and for some reason they need to come in, that they can still come in and see you, right?
Oh, absolutely. They definitely can come in with anything and do.
Perfect. So how about you personally? How are you guys doing with all the social distancing and things like that? How are you doing personally?
We're being very careful. For example, Eric and I come to clinic. We are wearing scrubs, which will surprise some of my patients because I usually have something nicer on. But that way we're able to change our clothes here before we go home, and trying not to increase exposures for anyone. And then we just stay out on the farm and work all weekend, and then 3 days later we come back and go to work at the clinic. We are extremely careful when we're out in public. We make sure that we're wearing masks and having limited excursions out into the community until some of this passes. Everyone here as well, we haven't had any sick providers to my knowledge, knock on wood, here at the clinic, and we're just carrying on and hoping that this will decrease the rate of infection.
Perfect. Anything else that you want to add?
No, I don't think so. We'll be glad when this is all over, and I'll be glad even with the telehealth patients to be able to put my hands upon them rather than through a television screen. But it is better than nothing to be able to see and communicate.
That's great. Well, thanks very much, Dr. Webb. If you'd like to make an appointment with Dr. Webb or any of our Healthy Connections providers, you can call 888-710-8220 for our scheduling office, or you can visit us www.healthy-connections.org.